Good afternoon. I'm Stacy Turpin-Saunders, Buncombe County Public Health Director. Today is July 21st, and thank you for tuning in to this Buncombe County COVID-19 community update. This update is also available in Spanish in real time on the Buncombe County Health and Human Services Facebook page. When we stopped our regular community briefings in June, I was hopeful I would not be addressing you again until sometime in August, as we initially were planning for back to school. But unfortunately, with rising cases in our nation, our state, and here in Buncombe County, it felt important to speak to you today. For a few weeks, we were all breathing a little easier. Our health department leadership and warriors felt like we could finally exhale just a bit as we were seeing consistently less than 10 new cases per day enter our public health workflow. Some weeks fewer than 5 cases per day. But in the last week or so, we have seen our cases rise consistently and steadily, and now we are seeing on average 16 new cases enter our public health workflow each day, and our percent positivity is increasing each week. As of today, we have identified 18,349 total confirmed cases of COVID-19 in Buncombe County since the pandemic started. And we have lost 327 of our neighbors and loved ones to COVID-19 related deaths. Cases per 100,000 per week have increased from 34 to 51 in only 1 week. As cases have increased, so has our percent positivity. Just a few weeks ago, this indicator was consistently below 2%. As of today, our percent positivity has grown to 3.4%, indicating increased viral transmission in our community. Our current Epicurve is showing a distinct upward trend in the recent weeks. I'm going to zoom in a little more on the tail of that Epicurve. In the last 2 weeks, there has been a clear and steady and persistent increase in cases each day. About 92% of all those new cases in Buncombe County in previous week were in individuals who were not fully vaccinated. The average age of new cases in our community is now around 39 years old. This is starkly different than earlier in the pandemic, when new cases skewed much older. What is different now from our early days? Nearly 80% of our 65-year and older population is fully vaccinated, but only 54% of those 25 to 49 years old are fully vaccinated, and even lower in younger groups. Lower vaccination rates put younger populations at higher risk for infection. Across the state, younger North Carolinians are more likely not to be vaccinated, and that is true for us here in Buncombe County too. With the more transmissible Delta variant growing exponentially and now being the predominant strain in our state, younger unvaccinated friends, family, and neighbors are at greatest risk. I just want to repeat that the overwhelming majority of our new cases are in those who are not fully vaccinated. This trend is true for our state and our nation, and this carries over to hospitalizations and recent deaths. The overwhelming majority of new cases, hospitalizations, and new deaths in our state are in those who are not fully vaccinated. Now is the time to get ahead of the trend that is emerging in our Epicurve that I was showing you today. And we have a way to reduce this risk and even prevent new cases: vaccines. Vaccines are our best chance to limit the impact of COVID-19, and particularly the Delta variant, on ourselves and our community. If you are unvaccinated, you are at the greatest risk for illness, hospitalization, and possibly the worst outcome, death. But you can change that. There is a vaccine waiting for you at an area vaccine provider. We have one for you at the health department and even at one of our outreach events. Currently, 54% of our total population in Buncombe County is at least partially vaccinated, and 52% of our total population is fully vaccinated. We can do better than that. We have to do better than that to fight back COVID-19 and its variants. The more protected we are amongst those who are eligible, the better we build a shield of protection around those not yet eligible, our youngest children, those younger than 12. They are depending on the rest of us to help protect them and keep them healthy and ready for back to school. If you are an adult who has not gotten vaccinated, consider protecting yourself so that collectively we can help protect our little ones and our whole community. We must do this now. The more the virus spreads amongst us, the more we give it the opportunity to create additional mutations and possibly more variants. When we are not vaccinated, we act as factories for the virus. We give the virus a place to make more of itself and make changes to itself. And then we distribute and spread those copies of the virus to others in our families, neighborhoods, and workplaces. But we can limit that viral supply chain and limit the productivity of the virus with vaccines. We have the tools to stop the spread, to protect ourselves, to protect the very youngest of us, and to protect our community. Please visit myspot.nc.gov to find a vaccine provider near you, or visit the health department at 40 Cox Avenue, Monday through Friday, 9 to 4 for your vaccine. And until you are fully vaccinated, continue practicing precautions like mask wearing and social distancing. Please remember, cases are rising, increasing the spread of Delta variant and putting our community at risk. Vaccines are effective in reducing the spread and protecting all of us. The more our community is vaccinated, the more we can protect our greatest and most precious resource, our children. Don't allow your body to be a factory for making and spreading COVID-19. Protect yourself. There is a vaccine ready for you. Thank you for your time today. Be safe and take care of one another. Thank you.